Good morning. Today is Saturday, July 15th, 2023. This is our regular Saturday morning Facebook Live class. Let me start first. Try the sound check, which is very important. Testing. Okay, sound check is good. And this is 9:30, so you can go ahead, start our program. Again, today's topic is a request yoga therapy for Parkinson's disease. This is basically a follow-up of the last week's one, the yoga therapy for restoring balance. So I'll go over with you the patho-physiology of Parkinson's disease and how yoga therapy is effective for Parkinson's disease. As I always say, this is from our experience, what we have, experience in our practice, and also will give you the concepts so that you can incorporate the daily practices, what you have, as a part of therapy for Parkinson's disease. So let's start with the pathophysiology, what is called the pathology, physiology, and will be the ultimate treatment. First, Parkinson's disease is a neurodegenerative disorder. That means degenerative. A portion of the brain cells started to get degenerate. They degenerate basically for the common people is the cell is not functional anymore, losing its function, and essentially it's going to die. This happens in the area called a substantia nigra. Nigra actually means the black. So this is the area of the brain which looks a little darker, which is seated in the area called a midbrain. Midbrain is below the brain cortex and above our brainstem. And when they start losing those cell function, the content of the cell is called a dopamine. The dopamine level goes down. The nuclei which is responsible for that are called a subthalamic nuclei, and in the basal ganglion area, which are your globus pallidus. But essentially, it is in the substantia nigra. So, you can understand that the pathophysiology is a degenerative disease. That means cells are dying, means it is aging, and there is a less dopamine. So let's see what knowledge we have from yoga therapy. If you look at your PubMed is the website for National Library of Medicine, and it has all the established research papers. And if you put in the search engine yoga therapy as anti-aging, you will see there is a multiple paper will come up that yoga therapy increases telomere length. Telomere is a part of your cell called mitochondria, and the telomere's length goes down with the aging process, and when the telomere length started getting longer or staying same, that exactly works as an anti-aging, prevents a degenerative disease process. So yoga therapy and telomere length. Go ahead and put in the search engine. You will see. I have all the papers. I don't have to tell you the papers, but let you find it out. Second, yoga therapy increases the neurotransmitters. This is one neurotransmitter. Obviously, dopamine is a neurotransmitter, and many a time we call a dope, dopamine, oxytocin, dose, dopamine, oxytocin, serotonin, and endorphin. So dopamine increases, and also another neurotransmitter which increases is called GABA. Gamma aminobutyric acid, which is connected to your sleep, and all the sleep medications are increasing the level of GABA. So the yoga therapy improves your sleep function. From the Ayurvedic standpoint, from the Ayurveda, Parkinson's disease is called a Kampa Vata. Kampa means shaking, and Vata is the dosha, the neurophysical body type, and Vata is responsible for movement. The process of digestion of the food is impaired, and the toxins of the food and the toxins of your undigested thought process are called ama. AMA. Ama is called the mother of all the diseases. There's a large number of ama. Ama blocks the nadis, the channel, so the prana cannot flow. Prana is a life force which needs to flow freely through the nadis to keep us in health. And the nadis are so blocked that Vata, the mobile energy, comes and knocks into that blocked nadi and creates the shaking, which is called a tremor, and your stiffness of the body. So yoga therapy, which causes a relaxation response and parasympathetic activation, which improves your digestive process, because whole digestive tract from mouth to the anal canal is supplied by parasympathetic nerve. Once the level of ama goes down, the Parkinson's disease symptoms starts getting better and better. Also in Ayurveda, the first line of therapy for a little severe Parkinson's disease is a panchakarma. Panchakarma is the 5 actions which are used in Ayurveda for your treating from chronic degenerative diseases. So now you can see first what is the basic pathology. First, pathology of Parkinson's disease with a low dopamine level is the spasticity of the muscles. Muscles are tight and contracting, creating a tremor. You will see the tremor in the hand, and also loss of balance. That means the functions of the brain, these functions of both sides of the brain gets into imbalance. So yoga therapy will be a relaxation response to create the relaxation of the muscles, so this thing is not going to take place, number one. Number two is stay in an asana posture for a long period of time to go through the stages of asanas, which is at the beginning, the contraction of the muscles called arambha, beginning. Then you call, when you stay in the longer time, muscle starts to relax. Before relaxing, it causes a little fasciculation called sthiti, stability. And then it gets a profound relaxation, which is called your visarjan. So once you come to the level of visarjan, you get a profound relaxation response, which affects your Parkinson symptoms. Then in a Parkinson, because of the tightness, you lose your posture. The spine, you started to get hunchback, and in a hunchback, then you had a fear of fall. So in a classic Parkinson people, you will be seeing, they will be, actually they used to come to my class, so they will be doing like coming and slowly, the fear of fall, slowly walking with a hunchback. So we will teach you the therapy for the Parkinson disease. Now let me tell you what our experience is. Our experience is extremely extensive experience. We were in Virginia Beach, Norfolk area. So there's an organization called American Parkinson Disease Association. The American Parkinson Disease Association has a chapter called Hampton Roads chapter. Hampton Roads is the area of Virginia Beach, Norfolk, Portsmouth, Suffolk, Hampton, Newport News. In that, the president was Don Broadway, and they're doing the annual. I think first time I joined is around 2013 or 2014. It used to call a boardwalk, walk and stroll, because all the Western concept of Parkinson disease is the Parkinson disease gets better when you're physically active. Whether it's exercise, it's walking, it's a running, whether it is a boxing, kickboxing, doesn't matter. Any kind of exercise activity improves. So they were doing there was a boardwalk in Virginia Beach, boardwalk, walk and stroll, and I used to teach the yoga therapy during that annual program for American Parkinson Disease Association. I think in 2017 or 2018 the name changed to called Optimism Walk, but I've been joining them every year, and the last session was in 2019 before the pandemic. After the pandemic, I moved to Washington DC area, and I'm still in touch with them, but they have not started the program yet. Next, the American Parkinson Disease Association has their chapter called Virginia Beach chapter, and the president was Ann Perkins. And Ann used to do a monthly, what should I say, the monthly session, actually monthly in-person session for the Parkinson disease people, and it basically like your support group. So it was basically a Parkinson disease support group, and she used to bring all the teachers for different therapy for Parkinson disease. So tagging on that support group, she requested me to do a monthly, once a month, yoga therapy for Parkinson disease. So I was teaching that in a wellness center called Wells Therapeutics in Virginia Beach. So we had extensive experience, and we'll tell you what is our extensive experience, starting from simple relaxation of the hands to your headstand. You will see in my Facebook when I put the announcement, I put it myself as doing a headstand, and would share with you the people who learned how to do a headstand. It is so relaxing that they used to lose all their tremor. So the signs and symptoms of Parkinson's disease. Parkinson's disease is generally, as I said, is a neurodegenerative disorder, and it starts a little older age, not an older, we call it a senior. So a ballpark number is around 60, age of 60, and it is more in men than women. More men suffers Parkinson's disease, and today, for some reason, we see a lot more Parkinson's disease in the younger population. I don't know if you know Michael J. Fox. There's a lot of celebrities who had a Parkinson's disease at very early age, even less than 40, 45, they have a Parkinson's disease. Before the therapy, even the medical and even the medicine and non-medicine therapy, the survival was not for that long. Survival was grim, plus it was a very devastating lifestyle. 15 to 16 years, 20 years was a max, but these days with the therapy, you get a lot more. So medicine-wise, what is given, obviously, since it is a dopamine is going down, medication to increase the level of dopamine. There's a lot of other medications for the Parkinson's disease. Then incorporate from the traditional Western medical concept is your physical activity. Any kind, you name it. They will tell you table tennis for Parkinson's disease, tennis for Parkinson's disease, kickboxing for Parkinson's disease, football for Parkinson's disease, running for Parkinson's disease, but anything about a physical activity. And some intractable cases, these days it is called your surgical, called DBS, deep brain stimulation. Basically what it is, they try to find out the area of the brain which is firing the abnormal signals to cause the tightening of the muscle and causing the tremor. Generally it is in the midbrain area where the substantia nigra is, where the nuclei pallidi is, and the basal ganglia. The surgeon puts a fine electrode in that area, and they connect with a wire with a neurostimulator, and they put it under the clavicle, under the skin, is like your pacemaker. It's basically a pacemaker for your brain to stimulate and to relieve the area which is misfiring for the Parkinson's disease. I'll come to the yoga therapy practices right now. So what do we miss? Okay, the symptoms. The symptoms are very subtle, and one of the most important symptoms is losing an autonomic function. And as you know, yoga therapy improves autonomic function, and yoga therapy brings the balance back between sympathetic and parasympathetic tone. So a person, a telltale sign will be maybe drooling. There will be drooling without any cause, knowing anything, but underlying is developing Parkinson's disease. Autonomic function, like a loss of blinking, they cannot blink. Loss of facial expression, loss of involuntary smiling. So these are the things a patient is going to tell you, and you have to make an note on that before it becomes a full-fledged Parkinson's disease. There will be a lot of water-related disorders like your back pain and a severe pain. Pain is water-related, constipation, bladder dysfunction. And we used to have people who used to say that I have a Parkinson's disease. Once I started improving my symptoms with the yoga therapy, my constipation is gone. My bladder function got better. All my back pain is better. So from a Western perspective, from a Western medicine, it's a hey, this is a neurodegenerative disorder. What does Parkinson has to do with your constipation or a back pain? But that's a part of your vata disorder. And also you'll remember that it's your vata energy entering into majja dhatu. Majja means your neurological tissue. There's 7 tissues: rasha dhatu, rakta dhatu, mangsha dhatu, medo dhatu, osti dhatu, majja dhatu, shukra dhatu. So 6 tissues of majja dhatu is a nervous tissue. And also there is called the kasha prana. The kasha means less, prana. This prana is a life force which is called mana baha srota. Mana is your mind, baha is the channel. The channel of the mind which has a less prana, which causes all the neurological symptoms. It's a wonderful correlation, wonderful connection. So the first, a person comes to you for your yoga practice, has no idea what yoga is. How do you start? You start first with a sitting in a chair. Very, very important concept, and start with the relaxation. My personal experience, the moment you start this relaxation, I will show it to you how we do it. We do it all the time. Do that with your hand mudras, closing your eyes, paying attention to your breath, keeping your spine straight. And then suddenly in a couple of people I have seen what we used to do, we used to have a chair, and in front of the chair we used to keep a yoga mat. They cannot sit down into the mat. They start sitting in the chair, and slowly with the practice they will get into the mat. It's a wonderful practice. So a person with a Parkinson's disease comes to you for yoga therapy, and your first and foremost will be sitting them in the chair with a spine straight. Why? Because the muscles are all tight, and the tightness of the paraspinal muscles, the muscles on the side of the spine, created like a hunchback. Plus, they have an imbalance between the functions of both sides of the brain, and the imbalance, their posture. The posture is so classic, and the posture is called a fear of fall. The fear of fall gives you a posture which is, what is the word should I use? Which is non-reproducible. That means you cannot reproduce, and it is classic. So don't sit down in a chair. The first thing we'll say, you keep your spine straight. So keep your spine straight means even if you're sitting in a chair in the front, your body will be in 90-degree angle. So somebody will complain that I cannot put my foot doesn't touch the ground. It's okay initially. Put a folded blanket. I'm against any blocks or any hurt thing, because slowly you will develop neuroplasticity and your feet started to go down. Then if you have a folded blanket, you just keep unfolding it and essentially go ahead. If you with the chair, if you sit in the back of the chair, you can go back of the chair but keep your spine straight. And for us, you have seen already, I'm sure most of you have seen, we call it your kneeling stool. This is a kneeling stool. When you sit down in a kneeling stool, you sit down and your spine becomes straight. So sit down. So for us, we always keep our spine straight. As you know, we'll sit down in a kneeling stool. This will be my keyboard, with my computer screen. So always work with our spine straight. So spine straight. Sit down in a chair. Next, touch your index finger and thumb. This is your Dhyana mudra or a Gyana mudra. And I'm going to take a little break because there's a lot of external noise. I'm going to put my AirPod, if you don't mind, because it is important for you to listen to all the practices I'm going to do. Just give me a minute here. Let me connect my Bluetooth. I'm sorry, I should have done it before. And let me see here. Full screen. Where did I go? Sorry. Again, just give me a minute. I want to be sure. Okay. If you have a problem hearing, please let me know, because this is very important. I want you to hear. Okay. I can do it from my side here, just to be sure. Testing, testing, testing. I can do it from my side here, just to be sure. Testing. Yes. Testing, testing. Okay, it's all good. So, coming back, I'm coming back again. I'm sorry for this interruption. But it's very important for you to listen. So hand is the connector between your body and mind. So you sit down with your spine straight, touch your index finger and thumb, and just put it over your knees. Second, your mind quiets down. We call it Merudanda Achal, spine is straight, and Manasthit. Mind will quiet down. Mind is the content of your five senses. So first is you close your eyes. You close your eyes. Bring your awareness to your breath. Breathe out first, completely effortlessly. Slowly take a deep breath in. And breathe out longer than breathing in. If you continue, in a short time, we'll enter into a profound state of relaxation. Then you slowly start a relaxation practice. You start with your hands. The hand gets relaxed with a mudra called a adhimudra or balo-mushti mudra. That means the babies, when the babies close their hand, remember, babies are completely relaxed and everything babies do is a yoga. So their hand will close, they put the thumb inside and close. This is called a balo-mushti mudra. Balo means baby, mushti is the fist. This is the relaxation of your hand. So never close your fist like this. Always close your fist with thumb inside and close. Initially your thumb may not go that far, but it will come. And the hand is relaxed, you will see your fingers are separated. Your fingers will go in and out, your hands will turn around. So this is the relaxed hand. The hand is not relaxed, the fingers will be close together and tight. Same way as the feet. On your feet, when they're all together, they're very tight. So what we do, we put our finger inside and separate our toes. We sit down like this. See, all the fingers are in between the toes and the toes are separated. When the toes are separated, it becomes relaxed. You can do it with breathing. So you breathe out first. Remember, you breathe out before your muscle contracts. Muscle needs your oxygen. So breathe out first. Deep breath in. Breathe out. Close your fist. Breathe in. Breathe out. Do it with the eyes closed. Breathe in. Breathe out. See, this is the practice we do every single day. And so we are pick and choose from a practice for Parkinson's disease. Hand get relaxed with extension. Breathe in. Breathe out. Flexion is tightening. Breathe in. We always practice with our eyes closed. When you practice with our eyes closed, we assess our subtle body. Breathe in. Breathe out. It's a wonderful practice. Elbow. Elbow gets tightened up with the external rotation. Elbow is relaxed with the internal rotation. This is tightness, this is relaxation. So if you do a prayer pose to the back, Paschim Namaskar, your elbows gets relaxed. Shoulder gets relaxed with a little relaxation. So you can do a shoulder relaxation. So put your elbows together. You breathe out first. Take a deep breath in and breathe out and slowly rotate your shoulder. Breathe in, breathe out. So bring the balance back, breathe in, you do the opposite side. When you're practicing, you do between 5 to 10 on each one, but here we are doing our simple, gentle relaxation. You can hold your wrist in the top, breathe in, breathe out, pull it down behind your head. In the same breathing cycle, put your hands way high up. Breathe in, breathe out to the opposite side. Get it high up again. Breathe in, breathe out. And very important thing is that you keep any asana practice for a longer period of time. Muscle will contract, it may last for a while, but if you stay in a one posture, say here I'm sitting in this posture for a long enough, then all my paraspinal muscles, the muscles side of your spine is getting relaxed. I can feel the relaxation here. Very important concept. Neck get relaxed with what is called our Brahma Mudra, a 4 position of our neck, and also the mind, the vata gets relaxed with your pranayama called Anulom Vilom Pranayama, alternate nostril breathing, and then because of the blockage of the channel nadi, we call it Nadi Shuddhi Pranayama. For the prana, when the prana is low in your Parkinson people, we do the pranic energizing pranayama, which is primarily a Bhastrika pranayama, bellows, which all of you know how to do it. And Bhastrika pranayama increases and brings your prana. So the reason I'm talking about that what we will do, we'll incorporate another pranayama called a Bhramri pranayama. Bumblebee breathing. In Bhramri pranayama, you shut down your 5 senses, you create a vibration like a bumblebee. Our brain has a frequency, 2 frequency interacts, cancels, and quiets down your brain activity. So it's basically you are quieting down the area of the substantia nigra, which is firing the neurons without being under any control. Then the sound of this Bhramri pranayama we will incorporate using your Paschim Namaskar and your neck movement, called your Brahma Mudra. So the practice will be like this. Okay, I'm getting a lot of good feedback. Sound is good, no technical issue. Okay, so the first, your Bhramri pranayama. Shut down your 5 senses. You put an index finger in the forehead, in the third eye. You can use your Shanmukhi Mudra, like using sit down, or you can close your eyes, use your thumb to close your ear and close your mouth. Breathe out first. Take a deep breath in and breathe out with the sound of a bumblebee. Breathe out first. Deep breath in. Then into another relaxation practice, pumming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses, use the hand as a cup, put it over your eyes like a cup. Let the eyes take all the heat from your hand. It relaxes the ciliary muscles. When the ciliary muscle is relaxed, the lens became more convex. All the muscles in the eyes get relaxed. Muscles in the eyes are supplied by cranial nerve, SO4, LR6. Superior oblique muscles supplied by fourth cranial nerve, LR6. Lateral rectus supplied by the sixth cranial nerve. Optic nerve supplies your retina, and the trigeminal nerve also supplies outside. Use your hand to massage your forehead. When the muscles are relaxed, muscles are attached to the skin. So all the frowning, all the lines goes away, and use in your face slowly. So all the lines and frownings in the face goes away. Take your hand and massage your earlobe, behind the ear, inside, even inside the external ear canal. But I have the ear pod. What is there called a auricular branch of the vagus nerve. It's a vagal stimulation. So bring the hand, massage your carotid sinuses on both sides. The carotid sinuses relaxes your cardiovascular system and the neurological system. Take the hand to the back, massage just below your occipital tubercle, where your sternomastoid and accessory muscles are attached, to give you a proper relaxation. Use your hand as a prayer pose to the back. We call it a Paschim Namaskar, and all of you have seen how to do it. If it is here, you stay here. Close your eyes. Do your breathing out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. Slowly, your hands will come up as a prayer pose. Then, if you stay in the posture, neuroplasticity will set in, and you will be able to keep it in a completely relaxed form as long as you want. Once you are relaxed, you'll be amazed that you feel more comfortable. Now you incorporate the relaxation of the neck with the sound of your bumblebee, Bhramri Pranayama. So slowly breathe out first. Take a deep breath in, put your head to the back. And breathing out, you use the bumblebee sound. This is a profound relaxation response and can be done by any person with Parkinson's disease who has never done any practice of yoga. Sit down in a chair, we'll be doing it. I'm sitting in a kneeling stool because I'm more comfortable here. And then when you put your head down, you look for two things. First, there is no pain. If you have a pain, you back off. But stay in the posture and slowly bring it down. Then listen to your breath. Your breath has to be effortless, because heart and lung is the same organ. If you put a stress in your heart with your physical activity, it will show up in your breath as the effort in breathing. In the same way, if you have an effort in breathing, then your heart rate will go higher, blood pressure will go higher. So there are 4 steps for this neck relaxation, which is called the Brahma Mudra. I'm so comfortable, I'm just going high up a little bit more on my prayer pose to the back. So again, one more time. Breathe out first. Take a deep breath in. to the side to side. Breathe out first. Take a deep breath in. Did you notice one thing? By incorporate this bumblebee frown, how long my exhalation becoming. Exhalation becoming a lot longer, and as you know, exhalation is parasympathetic, so it's activation of parasympathetic tone. Breathe out first. Deep breath in. Look all the way to the back without turning your head. Breathe out first. Deep breath in. Slowly turn our neck onto the left, to the back, to the right, and then right to the back, to the left. Drop your head down. Breathe out first. Deep breath in. Lot of my Western healthcare providers tells me, now you're relaxing your upper part of the body. You're relaxing your muscles of respiration, relaxing your chest, relaxing your neck. What happened to the rest of the body? Because the mind is in a reductionist mode. But yoga is holistic. You're able to relax your neck, you'll see your back will be relaxed, your hip will be relaxed, your whole body will be relaxed. So, started a practice. Yoga therapy is adaptation, gentle practice, and very subtle and slow practices. You start where you are. Start whatever level. Start an asana pain-free, no pain, effortless breath. And if you keep on doing it slowly, and slowly, today you are here. In a few days it will be a little bit more. It will keep on going because a phenomena called plasticity. So I'm relaxing my hand. I don't have to relax my feet like this all the time. It will happen on its own. Let's see. See a little bit here. Balancing poses, because you need to activate both sides of your brain. So for all people with Parkinson's disease, we teach them how to do it with your hand putting on a chair in front of you. So put a chair in front of you, and so for the sake for you to see, it will do that. Bring the balance back. I'm comfortable standing like this. Now it stands, everybody says stand like this, in the line of your shoulder, your feet, but bring your feet together. When you bring your feet together, you will feel a sense of little bit of a discomfort initially, but hold on to your chair, and then the non-dominant side. If you're right-handed, right-footed, see if you can stand on your left foot. If you can stand on your left foot, with the eyes open, keep counting. 5 seconds, 10 seconds, 20 seconds, 40 seconds. Count to the 42nd. In the meantime, what you can need to do, slowly and slowly, if you see if you can take your hand off. Stand on one foot. Then, the next practice, initially it will be almost impossible, but you will be able to do it. Do with your eyes closed. Your eyes closed, you're standing on your one foot, and slowly you let it go. Slowly you let it go. It's a wonderful practice, but even we become very wobbly when our eyes are closed. Go to the opposite side, now right side. And close your eyes. Close your eyes and see if you can balance. You can stand on one foot with your eyes closed. It's a very, very important. Once you can do it, you almost will overcome without Parkinson's symptoms. Then you practice slowly your precaution, tree pose. Take your foot there. Once you stand here slowly let it go. Your hands on both sides. Slowly hands will go high up. Hands will come down. Also, in a good posture, you can put your hands in a prayer pose to the back. Paschim Namaskar with your precaution. Many a time we'll incorporate a Kapalbhati pranayama with this. Kapalbhati pranayama, relaxing, a powerful relaxation practice. Practice your opposite side to bring the balance back. Now we're standing on the left foot. Again, hands on both sides, and goes high up, comes down. This will happen because this is basically, it needs a level of concentration. So you're doing on your own, nothing happened. I'm actually looking at your computer, so relaxation response, balancing asanas, and other powerful balancing asanas like your cow face, Gomukhasana, your Urdhva Sandhanasana. I showed you all those balancing asanas in the last session, which is yoga therapy to bring the balance back. And you can take a look on that and you'll see all the balancing practice is applicable for your Parkinson's disease. One very interesting concept is, which it's from our experience, is that a person who is doing his body get relaxed, essentially the symptoms of Parkinson goes away, even the constipation gets better, drooling gets better, blinking comes back, smiling comes back, but this hand tremor doesn't go away. Another interesting is in a Parkinson's disease, when they hold something, the tremor goes away. They're doing this when they hold on to a cup of coffee, bring the hand up. This also happens in intention tremor. Intention tremor, there is no underlying cause. Some of our participants of the Parkinson's disease wants to learn headstand, Shirshasana. We started teaching them Shirshasana in stages. In stages they learned it. And we have people in our class who have shown us that when they are in a Shirshasana and a headstand, this hand tremor goes away. I can give you the names, I can give you the pictures, when I present them. So in a headstand, in a Parkinson patient, whatever the residual hand tremor, it goes away. For the pranayama, what you practice, breathing out longer than breathing in, which you're doing it, is a Anulom Vilom pranayama, alternate nostril breathing, with your Nadi Shuddhi pranayama, cleansing your channel. You also do Bhramri pranayama, also do your Om pranayam, Pranava pranayam. Those are all like your meditative pranayama, which is called your Vata balancing. So if you can go to my YouTube, and you have done it, most of them you have done with me, Vata balancing practice, that's what you will do. So I'm not giving you all the practices, I'm giving you the concept so you can use it in your practice. So a balancing alternate nostril breathing, how to do it. First, you on your left hand use your Dhyana Mudra or Jnana Mudra, put it over your knees. The right hand, close your right nostril. You don't have to close all the way down, just put underneath, gentle enough will be good enough. Breathe out through your left nostril. And breathe in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Then breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. This activates both sides of your brain. You keep on doing it, and let me incorporate a little bit more balancing practices for Parkinson's disease, and I will be explaining more to you. We'll continue. Take your index finger and middle finger and put it in between your eyebrows, the third eye. Keep your eyes closed and bring your attention to your third eye in between eyebrows. Then as a super brain yoga, use your left hand, hold onto right earlobe. This is crossing your hand and holding the earlobe brings the balance. In this posture, you keep on doing alternate nostril breathing, and let me explain to you with the benefit of this, in particular to the Parkinson's disease. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Right brain is parasympathetic. Left nostril breathing is called a Chandranari, moon energy, relaxing. It's a parasympathetic. Right nostril breathing is controlled by the left brain. Left brain is analytical. Left brain is male. Left brain is hitting. Left brain is sympathetic. Right nostril breathing is called a Suranari, sun energy, hitting and sympathetic. It's activation of the both sides of the brain, balancing parasympathetic and sympathetic autonomic nervous system, and is a wonderful tool for Parkinson's disease. Parkinson's disease is a vata imbalance. So all the practices, vata is a mobile, it's a dry, vata is all the attributes of vatas you will keep on doing, completely opposite. Okay. You can do all the sets of meditation for Parkinson's disease, but this is most important. Alternate nostril breathing. You start with the Bhastrika, bellows, because Bhastrika will bring more prana. If you get a more prana in your Majja Dhatu, means your brain, you get your better therapy for Parkinson's disease. Do the Kapalbhati pranayama. It is being known that some toxins, especially when the carbon dioxide sitting in your system, all the herbicides, they also trigger Parkinson's disease. So, detoxifying pranayama, Kapalbhati pranayama, it's good. Alternate nostril breathing, what I just showed you. Now it is close, Nadi Shuddhi pranayama. Nadi Shuddhi pranayama is an alternate nostril breathing incorporating your kumbhaka, that means breath holding. So use your hand as I call a Vishnu Mudra, bring your index finger and middle finger down and put your little finger, ring finger and thumb as a pinch. Put the pinch on your nostril. You will be doing in a ratio of 1:4:2. That means one ratio will do a breathe in for a count of 4 in, breathe hold for a count of 16, 4, breathe out with a count of 8. 1:4:2. And then if you can do it more effortlessly, you can keep on increasing. You can do 5 in, 20 hold, 10 out. But let me just show you 1, 16 and 8. So close your right nostril, breathe out through your left nostril. Breathe in with a count of 4 in. Hold your breath for a count of 16. Breathe out through the right nostril with a count of 8. Breathe in through the right nostril with a count of 4 in. Hold your breath for a count of 16. Breathe out through the left nostril with a count of 8. One round of Nadi Shuddhi Pranayama. We generally continue 5, 7 or 10. Wonderful practice to cleanse up your channels. Amas won't get clogged because Ama is already being digested by parasympathetic activation, and prana will flow clearly with the Bhastrika Pranayama. Meditation, we teach them how to meditate with a focusing, like a vata, focusing like you close your eyes and you can do a breath-centered meditation. You can do a meditation with a focus like alternate nostril breathing without closing your nose, or you can do a visualize a flame that in front of you, focusing on the flame, or visualize a tip of a mountain, or your say you are sitting in front of your ocean in a beach. So let's just show you the technique how to do this meditation with your breath-centered meditation and with your meditation with your alternate nostril breathing without closing your nostril. Because what happens when you close your eyes, you enter into your subtle body. The gross body, in a subtle body, what happens? When you are in a state of your body-mind union, and you can do anything, you can literally visualize your subtle body, the body of your mind. The eyes closed, you can touch your forehead, touch your nose, touch your left earlobe, touch your left shoulder, your right heel, left heel, left great toe. So same way you can access the nostril without closing. People sometimes get very surprised how you can do it. The simplest way is, this is the Dhanu Mudra or Jnana Mudra. It quiets down your mind. Put it over your nostril. You visualize your breath. You breathe out first. Visualize your breath is coming in through your nostril. Your nostril is a filter. It's filtering all the dirt, the air you are breathing in. Your nostril is your personal air conditioner. If outside air is warm, it will cool it down, and outside air is cold, it will warm it up. Air goes into the side of the nostril, which is called turbinate. It generates a vortex. The vortex goes over your sinuses. In the mucosa of the sinuses, this vortex secretes a substance called nitric oxide. Nitric oxide is a powerful vasodilator, and it also is one of the transmitters of your parasympathetic activation. Parasympathetic is activated by acetylcholine, cyclic GMP, nitric oxide, and it maintains your endothelial health. And endothelial health is the real health. Visualize the air coming behind of your throat. Visualize going behind your throat, upper part of your lung, Right lung has 3 lobes, left lung has 2 lobes. Trachea goes down, branches into all the bronchial and bronchioles. Air is entering in the top of the lung, middle of the lung, lower part of the lung, all the way down to your belly button. Breath stops there automatically. It's called your cable kumbhak. Take that nice stop, relaxed breath. Then visualize breath is coming out from the lower part of the lung, middle of the lung, upper part of the lung, behind your throat, coming out through your nostril outside. Outside it picks up prana. Prana is a subtle energy. Breath is not prana. Prana is like electricity. Breath is a carrier. Like breath is like electric cable. The breath is picking up prana, and in yogic tradition our whole body does breathing. It's not only lung. Our skin is breathing, kidney is breathing, liver is breathing. Then you visualize your prana is going to the organ of healing. I have a heart problem, I visualize my prana is going to my heart. If you have a back problem, you visualize prana is going to your back. If you have diabetes, you visualize prana is going to your pancreas. So prana entering into the organ does the healing, called pranic healing. Then slowly you bring your awareness to your nostril. And do all this thing in silence. I'm guiding you, that's what I'm talking. Otherwise you'll keep your spine straight, hands in a dhanu mudra, both sides, gently over your knees, and then you'll be doing silence. Bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly visualize my air is coming out from my left nostril and air is going in through my left nostril. Close your eyes, stay in silence, and continue alternate nostril breathing without closing your nose. We have so much of experience with people with Parkinson's disease that this practice is a wonderful addition. It's not going to take much time. Slowly you bring your hands in front of your heart chakra. Touch your little finger and thumb, separate your ring finger, middle finger and index finger. Padma Mudra, Lotus Mudra. It connects your body, mind and spirit. Slowly bring the Padma Mudra close to your heart. Heart is the site of your soul. We memorize by heart. Yoga therapy is a wellness, restoration of your wellness. Wellness is a state of art, it's a phenomena. You carry it all the time. It's a conscious awareness to be well, both physically, mentally, and spiritually. Yoga therapy brings physical wellness, mental wellness, spiritual wellness. It brings a relaxation response, parasympathetic activation, increasing in the neurotransmitters, primarily the dopamine, oxytocin, serotonin, endorphin. Hand comes in front of your heart chakra, Anahata chakra. Bow your head down, say Namaste. Namaste literally means I honor the divinity within you. You are divine. The moment I accept you as divine, all my chronic diseases disappears from my body and mind. Thank you for joining today with a wonderful session, Yoga Therapy for Parkinson's disease, and it was a request, and very timely request, because it was basically following our last session, that yoga therapy for your restoring balance. Next Saturday, I'm not sure, I may have some already assigned programs, and I will let you know, and I'll post if I have to cancel the program. Most likely not, but I will let you know. Okay? Thank you for joining. Enjoy the rest of your day. Oh, again, just if you have any comments, questions, please put it on the Facebook, and I'll be glad to answer for you.